Everything you need to know about infertility. Infertility happens when a couple cannot conceive after having regular unprotected sex. It may be that one partner cannot contribute to conception, or that a woman is unable to carry a pregnancy to full term. It is often defined as not conceiving after 12 months of regular sexual intercourse without the use of birth control. Signs of infertility.
Signs of infertility. What exactly is infertility? The problems with either conceiving a child or with carrying out the pregnancy to its eventual fruitful end fall under the definition of infertility. Infertility is the incapability of an individual to become pregnant, in the case of females, or the incapability to induce pregnancy, in the case of the males. The inability of an individual to carry out a pregnancy to its full term is also dubbed infertility. How does one recognize infertility? Signs of infertility are not always evident. Most people go through life without knowing there is a problem with their reproductive systems, attributing failed pregnancies to providence. In fact, miscarriages are the most common indicator of infertility. Signs of infertility in women. In women, the signs of infertility are more readily recognized as compared to men. Endometriosis causes the lining of the uterus to grow outside the uterus. Bacterial infections may begin around the uterus and spread to other reproductive organs, resulting in infertility. Fibroids in the uterus are indicative of infertility. Tumors in the cervix often cause stenosis, or narrowing of the cervix, which is a common indicator of infertility.
Ovulating before the 10th day and after the 20th day of one's monthly cycle, premenstrual spotting, menopausal symptoms, etc. are indicative of luteal phase defect, and thus in turn are signs too. Irregular menstrual cycles are the most common indication in females that they might have some problems with fertility. However, an irregular menstrual cycle is not conclusive in itself, but it is definitely one of the signs of infertility. Issues regarding body weight are often indicators of being infertile. For a woman, being too thin, or anorexic, will definitely hinder pregnancy, since the body does not have the proper nutritional requirements or the required strength. Alternatively, obesity can also be a sign. Obesity is accompanied by hormonal imbalance, which affects the reproductive system in pregnancy. Signs of infertility in men. Like females, in males too, either obesity or anorexia is an indication that he is infertile. Apart from these, anatomical defects may also be signs of infertility. Undescended testicles, or damage to the scrotum and the gonads, are possible indicators too. Wearing tight undergarments, or exposing the testicles to heat, may render the person unable to produce the required number of sperms, or unable to produce sperms altogether, resulting in infertility. Determining the signs of infertility. There are many medical procedures for detecting the signs that help to determine whether an individual is infertile or not. Doctors usually prescribe one or more of the following medical tests. 1. Hysterosalpingography. A dye injected into the vagina is monitored to check for blockage in the fallopian tubes or uterus. 2. Laparoscopy. If disease and other physical problems are present in the ovaries, fallopian tubes, or in the uterus, infertility is suggested. This may be detected through laparoscopy. Infertility is a problem that can be solved if it is addressed in a holistic way, which is, using a multifaceted method of healing. Getting regular health checkups, taking supplements to combat existing problems, exercising, and stress reduction techniques are only part of the holistic solution to infertility. The holistic approach is not only a surefire way to increase your chances of conception, it also guarantees a safe and healthy pregnancy. The real cause of infertility. Infertility can be defined in two ways, as the inability to conceive after a year of regular sexual intercourse without contraception, or as repeated ectopic pregnancies, miscarriages, or perinatal loss. Male and female specific factors account for about 30% of the infertility causes. Individually, the combination of male and female causation leads to an additional 20%, and the remaining 20% are caused by uncertain origins. When one is dealing with infertility, as much as it is important to strictly follow the rules of the treatment, it is equally important to make sure that you have the correct diagnosis of the root cause of your condition. In this video you will find a broad outline, enumerating the various probable causes of infertility. Why it is important to determine the causes. Infertility may be caused due to a multitude of factors at a time, or it may be the result of perhaps the deviation of a certain single factor from its premeditated path. Since misdiagnosis can often lead to further fertility complications, the very first step of treating and curing infertility depends largely on identifying the root cause right at the beginning of treatment. The broad causes of infertility in females may be listed as follows. 1. Anovulation. In females, ovulatory problems are the most common causes of infertility. The failure to ovulate may be due to a number of factors. Hormonal imbalance is the most frequent cause of anovulation. When the ovaries produce immature eggs, pregnancy becomes impossible. Women with polycystic ovaries suffer from a decreased secretion of FSH and increased secretion of LH and testosterone, therefore polycystic ovarian syndrome may lead to anovulation in women. Approximately 20% of the cases of infertility occur due to the malfunctioning of the hypothalamus, the gland which controls hormonal stimuli, resulting in immature eggs. The pituitary gland is responsible for the regulation of LH and FSH, and its malfunctioning produces immature eggs. Damage to the ovaries caused by previous surgeries, ovarian cysts, tumors, and infections may lead to the production of immature eggs as well. Premature menopause and follicular problems are also responsible for anovulation. 2. Improper functioning of fallopian tubes. Viral and bacterial infections of the fallopian tubes are the primary cause of their malfunction. Appendicitis and colitis are abdominal problems that lead to blockage of the fallopian tubes. Tubal damages may also be caused by previous surgeries, which render the tubes incapable of passing eggs. Ectopic pregnancy, which occurs within the tube, is a potential threat to life that also causes tubal damage. Congenital tubal defects are rare, but not impossible to come across as causes of infertility. 3. Use of drugs. Smoking, drinking, and using other drugs have been known to decrease the chances of getting pregnant. 4. Problems in the immune system. This problem includes autoimmune reactions in the body and the creation of anti-sperm antibodies which exterminate sperms. Natural killer cells, which when present in excess, can damage the embryo in the uterus. The anti-nuclear antibodies cause inflammation of the uterus when present in excess. The presence of anti-sperm antibodies in the female's body kills off the sperm before they can fertilize the egg. Although the causes of infertility are many, they are fairly easy to overcome, especially when diagnosed in the early stages. Using a holistic approach, comprising of the prescribed medicines, following a healthy diet, regular exercise, abstinence from alcohol, nicotine and other drugs, stress management, acupuncture, etc. guarantees positive results. Due to the complex and multifactorial nature of infertility, the problem can be solved permanently only by dealing with it in a holistic way, which tackles all the root causes of this condition rather than focusing on specific triggering elements.
Infertility treatments. Infertility treatments. Infertility is a global public health concern and affects approximately 10% to 15% of couples worldwide. This condition may stem from numerous anomalies in the body, ranging from infections and cysts in the ovaries and reproductive tract to the disproportionate secretion of hormones by the glands. Infertility treatments are many, and are of various kinds. The best way to tackle it is to identify the exact cause of this condition and then alleviate it. Available infertility treatments include 1. Treating APAs. APAs cause blood clots and prevent implantation. A low-dose aspirin therapy works wonders when treating APAs in the blood. For graver cases, anticoagulants are used to thin out the blood and improve blood circulation in the uterus. 2. Removing natural killer cells. Natural killer cells present in excess begin to attack the embryo. An intravenous treatment of gamma globulin, intralipid infusions and steroids are often used in this case. 3. Treating anti-nuclear antibodies, AAs. The abundance of anti-nuclear antibodies in the body is treated with steroids, intake of herbs that increase circulation, intake of antioxidants, zinc supplements, alkaline-generating food and reducing the levels of stress. Balancing the responses of the immune system is the key to treating AAs. 4. Treating antisperm antibodies. To suppress the reactions in the body caused by antisperm antibodies interacting with the sperm, low doses of steroids are often made use of. 5. Treating age-related infertility. Since age is a possible threat to female fertility, infertility treatments involving care of the kidneys and the spleen will help the woman keep the age-related problems of pregnancy at bay. 6. Treating infections that hinder pregnancy. Antibiotic treatments to exterminate the harmful bacteria from the body are recommended by most doctors who conduct IVFs. Nutritious food and immune-enhancing supplements are used to prevent harmful bacteria from growing in the body. When detected in one partner, antibiotic treatments for harmful bacteria must be carried out in both partners since they are likely to have infected each other during intercourse. 7. Treating the hyperlactin levels in the body. Normally, to treat the elevated levels of prolactin in the body, natural remedies are suggested. These natural remedies include the intake of vitamin B, zinc and magnesium supplements, exercising, staying away from alcohol, and lowering the levels of stress. The intake of rebalancing hormones like chasteberry, etc. is also helpful. Qi-moving herbs are also quite helpful in these cases. 8. Treating luteal phase defects. In case of dealing with luteal phase defects, fertility drugs like Clomid, etc. are prescribed for boosting the levels of progesterone, which enable pregnancy. However, medicines such as these are bound to have side effects, and to avoid these said side effects, it is always beneficial to opt for natural methods of treatment. Traditional Chinese medicine offers good help in these cases. 9. Treating tubal blockages. Laparoscopy is performed to remove small areas of blockage, however if that fails, in vitro fertilization is an option. 10. Treating sperm problems. Fertility drugs are available that enhance sperm production, and improve motility. Since sperm motility is one of the major factors affecting pregnancy, treatments in males are incomplete without looking into this. Infertility treatments are possible with the whole new range of medicines that is available to the public these days, but it must also be kept in mind that these treatments can be painful, often come without harmful side effects and the results are far from guaranteed. On the other hand, following the holistic approach with a healthy diet, regular exercise, abstinence from alcohol, nicotine and other drugs, stress management, acupuncture etc. can almost guarantee positive and fast results.
How to get pregnant naturally. Infertility may be broadly defined as the inability to get pregnant after trying for at least 1 year without using any birth control. In Western countries, infertility affects an estimated 15% of the population. While a part of them are trying to conceive using alternative methods like IVF, others prefer to optimize the chances of getting pregnant naturally. Trying to get pregnant naturally may be very important, since many couples and individuals who are diagnosed with infertility may be able to get pregnant without treatment, and hence should be defined as subfertile rather than infertile. When trying to get pregnant naturally, the most important factor is understanding the menstrual cycle and the timing of ovulation, leading to the optimum chances of getting impregnated. Usually, ovulation occurs around the 14th day, and hence, to get pregnant naturally, a couple should have as much sexual intercourse as possible between the 12th and the 15th day. Different women have slightly varying menstrual cycles. Hence, to improve the chances of becoming pregnant, it is imperative to study one's periods and calculate exactly when one ovulates. Determining the signs of ovulation. To check for the right timings of ovulation, a woman can do one, or many, of the following things. 1. Keep a calendar. Keeping a calendar to chart the days is an easy and effective method to determine the right time to have sexual intercourse. 2. Keep a check on vaginal fluids. Mucus discharge from the vagina usually becomes heavier, thinner, clearer, and stretchy during ovulation when compared to the usual times. 3. Feel the inside of the vagina. During ovulation, the cervix is softer and slightly more open than usual. 4. Keep tabs on any sharp pain in the abdomen. Sharp pains in the abdomen, or some slight spotting, may be indicative of ovulation. 5. Other physical conditions. Headaches, bloating, breast tenderness, and pain may be signs of ovulation. Having checked for ovulation, there are some other things that an individual can do to increase the chances of getting pregnant naturally. These include lying still for a while after having sexual intercourse, avoiding the bathroom for about 30 minutes after having sexual intercourse, and most importantly, figuring out how many times one should have sexual intercourse. Men often neglect their part to play in this whole scenario. The sperms need to be of the correct constitution, correct shape, and correct motility too, or else, however fertile the women may be, impregnation does not occur naturally. A way of ensuring that the sperms are undamaged is by wearing boxers instead of briefs. Boxers help in keeping the testicles from overheating and damaging sperms. The anatomical and hormonal factors are not the only ones to be monitored and corrected for both women and men. In most cases, failure to conceive may result from an improper diet, undue stress, the use of drugs like alcohol and nicotine, and even environmental factors such as proximity to harmful doses of pesticides. Abstinence from such factors goes a long way in ensuring a pregnancy. One should always keep in mind that the holistic approach to solving a problem is the optimal way to tackle infertility. Getting regular health checkups, taking supplements to combat existing problems, exercising, and stress reduction techniques are only part of the holistic solution to infertility, which considers the problem as part of a whole, unlike the conventional approach which tackles a specific body organ in its attempt to heal. This video is based on the book, Pregnancy Miracle by Lisa Olson. Lisa is an author, researcher, nutritionist, and health consultant who dedicated her life to creating the ultimate pregnancy solution guaranteed to permanently reverse the root of infertility.
Thanks for watching. If you have learned something, please subscribe to our channel and turn on the notification bell and give it a thumbs up, and don't forget to leave a comment in the comment section below to be the first to get subsequent releases through our channel. And if you're on phone or on tablet, don't forget to like and subscribe and turn on the notification bell as well. And help us share with your friends and family. We love you. Home Kiosk TV.